Hello and welcome, everyone. Thank you for joining us this afternoon, evening, or morning, depending on wherever you are. My name is Megan Aikens. My pronouns are she, hers, and I am the Director of Strategic Partnerships and Gender Equality at CanWaCH. Last October, in 2019, CanWaCH hosted a webinar on the role of Menstrual Hygiene Day, MH Day, to raise awareness on the importance of menstrual hygiene management and also share data and evidence on the topic. Today, we'll be discussing how you, as an individual or your organization, can take action digitally and join the global health community to coordinate activities in the lead up to Menstrual Hygiene Day this coming May 28th. Before diving in, I'd like to start with a land acknowledgement and then pass the mic to my colleague, Tina, who will go over some Zoom logistics and also explain how the simultaneous translation will work for today's webinar. I'm joining you all today from beautiful Deep River, Ontario, located right along the mighty Mississippi. I pay respect to the Algonquin people, who are the traditional guardians of the land upon which I live and work. I acknowledge their longstanding relationship with this territory, which to this day remains unceded. And I pay respect to all Indigenous peoples in this region from all nations across Turtle Island. As we dive into today's webinar, knowing that we still have a long way to go in addressing both the stigma and the shame associated with period and menstruation, it's also important to acknowledge the progress that we've made here in Canada and around the world in ensuring that conversations about periods and menstrual education is normalized and that access to services and clean wash facilities are available. In acknowledging the progress, we have amazing speakers today who have played a key role in engaging with individuals, communities, and decision makers to increase knowledge of periods, as well as access to menstrual hygiene products. We are happy and fortunate to have Ina, who is the International Coordinator for MH Day and the Head of Behavior Change Communication at WASH United in Berlin, Germany, join us. And as our first speaker, she will share WASH United's new campaign for MH Day 2020. After Ina, we will hear from Jennifer and Florence, Research and M&E Coordinator and Managing Director, respectively, with Femme International. Then we're excited to hear from Neil, the Director of the CLC Labor Participation Department at the United Way of the Lower Mainland, and Nikki, who is a public engagement and campaign expert with over 20 years of experience in politics, strategic communications, and government relations, and is a principal at Earnscliffe Strategy Group and the co-chair of the United Way Period Promise campaign. After the three presentations, we will hear from Jane Hope, who will share ISLE's plans for the month of May, followed by a Q&A session with the speakers. If throughout the presentations you have any questions, please kindly submit them to the Q&A panel instead of the chat box. Thank you so much. And with that, I'll pass it over to you, Ina.
Thank you very much. Yes, that's me. And thank you, CanWaCH, to host this webinar. And for those of you who joined last year, where we had a reflection on the past MH Day events, I can really highly recommend to revisit that webinar, where we also had partners such as Plan and a few more from Canada sharing their previous experiences and how they used, exactly like you said, Megan, MH Day as an opportunity to raise the challenges, celebrate successes, but also ask for more action and commitments. Can I use forward my slides, or will you do it? Yes, perfect. So my presentation will give you some inspirations how you can participate at an MH Day and what we as the Global Secretariat provide you with materials and other tools to celebrate it. And first of all, and that's why we hold the presentation today and the webinar, MH Day is happening besides Corona, because periods don't stop for pandemics. It's highlighting the challenges that are existing and maybe even aggravates this. I can recommend a few resources later in the chat box where you can check out how MHM, menstrual health and hygiene, relates to the Corona COVID-19 crisis. Happy to share that. So yeah, next slide, please. So I'm going to talk, I don't talk about what has been achieved. You can see the previous webinar. I talk a little bit about the adjustments, how you can participate, and I'll share some sneak preview into the materials. Next slide. So of course, the theme for 2020 is it's time for action, but we also use very likely the hashtag periods and pandemics to just use the Corona discussions as a Trojan horse. And I want to share on the next slide a little bit how our thinking shifted. So because of the coronavirus pandemic, and why you understand why this year will be likely very different for all of us. So there will be almost no on the ground events, which are usually making MH Day so colorful and exciting for everyone around the world. But let's be creative and campaign online like crazy. With the hashtag It's Time for Action, we actually intended to ask government, donors, and partners to share their action commitments. But we realized that this year it's very, very different and difficult to solicit actions and commitments. So what we plan to do is engage governments on a very easy level through the menstruation bracelet, which I'm going to explain later, video and live stream shows. So we can follow up with them later. And we use, and while media and government attention will be so much on Corona and COVID-19, we use Corona as a Trojan horse, kind of an entry point to engage, and we have also dedicated illustrations, text, and infographics to that. So yes, it will be very different, probably not as big as the last years, but let's make it big online. And I will explain you on the next slides how you can participate. Exactly. So first and foremost, we really want to establish the menstruation bracelet as the global symbol for menstruation. Similarly, like the red ribbon for HIV/AIDS, like the fist and the rainbow flag for LGBT. And for that, pretty simple, there's a bracelet consisting of 28 beads, as you can see here. And on the next slide, you can see already how we, next slide, yeah, how it has been used already in the previous years, but not really as thorough. And you can also see the Canadian Minister of Foreign Affairs that we met, who also wear it as a sign that periods are nothing to hide. Next slide. So there are different options, and I have the link down there where you can get all this. And because there's not so much time, there's a lot of text, but there's actually two ways. Either you can build the bracelet and you can use it very like with beads, but also like simply with paint. I used red lipstick and toothpaste. So I have a very, very cheap bracelet. And then you post a picture of you online. If you're not able to create or post a picture, you can also use illustrations, and we have also some funky Instagram GIFs. Yes, how to make it, you will find on this link below. We also want to create another crowdsourced video, such as last year, where partners contribute very small video snippets, and we combine all these small snippets to one global video. Next slide. If you send it to us by 14th May, a video with a message wearing the bracelet, that would be awesome. So we have a contribution. The video should be short, but if it's a bit longer, don't worry, we will upload all videos and we'll see how we can use it also later on in the day. So I hope you can send us some statements from Canada. Next slide. For those of you who work on education around menstruation, that can be through direct engagement with girls in schools, etc., but also online education. This is interesting maybe for you. It's called the Action for MH Education, a global monitoring on how many girls have been reached. And the next slide also provides you with a link. So last year we had 41.4 million girls as a commitment, and this year we want to follow up if this number has also been achieved. We won't ask for numbers for 2020 because it's just too difficult and sheerly impossible. campaign materials. This is, of course, most exciting for almost every one of you. So we have on the next slide a small sneak preview. We have 3 female artists, maybe even a 4th one, who created the most diverse set of campaign materials that we had before. They will be ready early next week, and we share that. We also we will also have text, and we're working on a kind of a combination of illustrations and info, like a kind of an infographic linking the corona pandemic to menstrual health and hygiene. So this you can expect by next week, but I hope you like what you see. Next slide. If you want to create your own materials using the design system, so it's a coherent campaign, we also have all this on the website, and here are some examples how partners have used the design system to create their own look, and it still looked like it's part of the MHD campaign, which was great. Next slide. So if you work on social media, here are the hashtags. It's time for action, MHD 2020, and you can tag us so we can find you. Yes. I'm rushing through. I hope the translator will follow. So what we plan ourselves on 28 May is a global online live stream show. In Germany, we're crazy about the Eurovision Song Contest. I don't know if Canadians know about it, but basically we want to present on the day presentation, talks, and videos, and you can all log in. The idea is to really do this for partners, so not necessarily for communities, but really showcase ideally progress in country, policy ask, and so on. So if you go to on the next slide, we're looking for content, and of course we would really love to feature what Canada has done on menstrual health and hygiene. As Megan also said, there's also been progress in your country. And also, for example, the mayor of Toronto has used the MHD the last years to always make bigger announcements, and we can tell that story. And I would really would love to reach out to you to see how we can feature Canada in the global live stream show. So keep that in mind, and I will definitely follow up with you. Next slide. If you're planning your own campaigns and events, please let us know. I have the link on the next slide, and then they will show up on our website. And this is good to know. It's always good to know your plans before, because then we can also amplify as much as possible and rope you in into what we're doing. And I think I'm almost done. Maybe next slide. Yes. So in a nutshell, what we will never stop, and let's make the most out of MHD. So we keep the momentum. The main aim is really this year to establish the bracelet, and I hope you all like it, join us. And we have campaign materials for you, the guides. We have an online event, and we're trying to amplify as much as possible. Yes, and if you have questions and ideas, I always like to listen to it, and hope I kept the time. Yes, I did. Wow. So sorry for rushing through. These are our handles and how to stay in contact. Thank you very much. That is only 4 sending. We can reduce that. Thank you.
Thank you so much, Ina. And now over to you, Jennifer and Florence.
Just a quick overview. We're from Femme International. We're a menstrual health NGO, and we began operations in 2013 with the goal of decreasing the barriers that menstruation inevitably raises for women and girls, affecting all aspects of their lives, from their mental and physical health to their ability to attend and participate in school and work, income generation, personal safety. The issues caused by menstruation ultimately become a gender equality and even more so quality of life issue. And I'm just going to take this moment to say that Femme knows that not all people who menstruate are women and not all women menstruate, but unfortunately in our context where we work, there's a very strong gender binary. And so please excuse me if I say women or girls instead of menstruators, as I just did. Next slide, please. So the main focus of what we do is called the Twaweza program. It means let's go in Swahili. It's an education-based workshop that we run in schools, women's groups, communities, things like that, and basically consists of interactive workshops covering a wide range of topics related to menstrual, reproductive, and when it's appropriate, sexual health. At the end of these workshops, participants get what we call a Femme kit. You can see examples on the slide there. And it's been specially designed to contain items that make menstrual management a bit easier. A bar of soap, it's become even more important now, towel, underwear. It's really hard to use disposable or reusable pads if you don't have underwear. And then most importantly of all, a reusable menstrual product. So during the workshop, participants will learn about washable pads and menstrual cups. We work with both these options. And at the end, they get to choose which one they would like, something that we feel is very important. Next slide, please. And so the next thing that we have going is called the Twende Initiative. And Twende means let's go in Swahili. And this one grew from participant feedback. So every time we went for M&E somewhere, monitoring and evaluation, people wanted to know where they could get the cups or pads for their sisters, their mothers, daughters, aunts, everyone else, all the other menstruators in their life. And the answer had always been, you can't, except for in a few large cities or for higher income people with online access. Reusable products are just not available in East Africa, and disposable products tend to be much lower quality, and their purchase comes with a lot of other barriers, such as the transportation to get there, time, that sort of thing. And thus, the Twende Initiative was born. Basically, women in their communities are trained and they act as sales agents. And so for the Canadians, you may recognize the Avon Lady model here. Yeah, it did come from that idea as well. And so these women, they hold meetings with stakeholders, they run workshops, they do sales. Because they're based in the community, they're able to provide longer term follow-up and support, which is really key to behavior change as well as product usage. They offer payment plans to ensure affordability because the upfront cost is a major barrier, especially to higher quality products. And they generally help to tackle stigma and be a source of accurate information on an ongoing basis. Next slide, please. One of FEM's key priorities is research. If it's not counted, it doesn't matter, and women are generally not being counted. Despite the fact that menstruation affects half the global population for a significant proportion of their lives, data is not being collected. There are no indicators for menstrual programming or even for clinical health. For development, for example, in the SDGs, menstruation is not included, nothing. The first standardized tool was just published last month. So how can we have any idea of what's going on, what the situation is, what works, what doesn't, without good data collection? And so FEM has been very involved in pushing and advocating for tools and research and funding, developing different research and M&E tools from a theory of change. You can see on the slide, there's a model that FEM was involved in helping to develop, training and data collection on M&E to enable it. And whilst M&E is a specialized skill set, we're also investigating ways to make it more accessible to all NGOs and programs. And so if anyone's interested in this, please get in touch with us. Next slide, please. And so now we're starting to tie in with what the main topic is, periods and pandemics. Like everyone else, we've had to think about how we can adapt to a global shutdown. In places like Kenya or Tanzania, working remotely or online isn't possible. Therefore, doing workshops in the form of webinars isn't either. Things like keeping distance, washing hands with soap and doing so often, isolating, they're just not possible. And that means that menstrual needs, along with many other needs, become greater. And so for FEM, based on government and WHO guidelines, research, and other successful programming, we've adapted what we do, and this is sort of what it looks like. And you can see from the photo there, we have a budget now for hand washing or wipes at the entrance to wherever we're doing the workshop. There's no pulling out your phones, no passing around any samples. We hand out the kits at a different time. whenever possible, we do the workshops outside. However, during rainy season, that's a little bit difficult. And we reduce the number of people in a workshop at any given time. And we always make sure to consult with local national regulations and laws. There's no handshakes. And maybe the hardest part for us is there's no tea or snacks, which is quite difficult. But, you know, periods don't pause for pandemics. Next slide, please. And so by now you are probably wondering what this all means for you. Ina just made a great presentation about their advocacy campaign and plans for MH Day this year. And so how does you buying and wearing a bracelet, posting the videos, all these suggestions and things that WASH United is doing, how does that then matter to the femmes on the ground in East Africa or other places who are trying to implement programming? A lot, actually. It's things like your support, liking on social media, volunteering skills. It's donations so that we can survive this pandemic and we can continue doing what we're doing best. Because, for example, these adaptations that I listed previously, they're a lot more expensive. There's extra costs involved and we're reaching fewer people. It's the advocacy and movement building where you're spreading the word, putting it out there, you're telling your friends and colleagues, you're bringing up menstruation, you're saying the words and making people hear the words until they don't flinch and you can say them. It's using language that's inclusive and non-stigmatizing and non-gendered so that nobody who menstruates feels ashamed or excluded. For example, when you talk about sanitary pads, it's really hard to then teach that periods are not dirty or contaminating when you just said that you need sanitary pads. And another thing that I mentioned earlier, when you talk about women instead of menstruators, it excludes and marginalizes groups of people who are already excluded and marginalized. And it may not seem like a lot to you, but these things really do matter when you put them together. And they become a slow build over time until it reaches until it becomes a critical mass. Next slide, please. And so at the end of the day, menstruation is pretty common. We all, well, half of us do it. It's not rocket science. It's just a period. Thanks, everyone.
Thank you so much, Jen. And with that, I will turn it over to Nikki and Neil.
Hi, everybody. My name's Neil. I'm the director of the Labor Participation Department at United Way of the Lower Mainland. Can you go to the first slide, please? And to the second slide. The United Way of the Lower Mainland runs this campaign called Period Promise, which Nikki's going to speak about specifically. Nikki is this incredible volunteer coordinator, co-chair that we have on the campaign. And she's so embedded in this work that it would be, she's the most important person to speak about it. But I want to speak briefly about what United Way of the Lower Mainland is. Our goal as an organization is to serve the needs of our local community and ignite the desire in everyone to improve this place that we call home. And several years ago, we started working on the issue of menstruation and access to menstrual products for people living in extreme poverty or vulnerability. And we started to do that using this particular vision, focusing on building our campaign around the concepts of mobilizing, collaborating, and giving. Now that's all I'm going to say. Nikki's going to take it over from here.
Thank you, Neil. And we could advance the slide, thanks. My name is Nikki Hill. My pronouns are she, her. And as Neil said, I'm one of the two co-chairs of the United Way Period Promise campaign. The other co-chair, Suzanne Skidmore, will be participating in a webinar later this month with this team as well. And before I start, I also want to acknowledge we are in beautiful Vancouver, BC, and acknowledging that we are on the unceded territory of the Musqueam, Squamish, and Tsleil-Waututh people. So as Neil started to lead in, the United Way launched this menstrual collection campaign in late 2016 with our first drive in 2017. You can see on the slide where a lot of our focus has been on collecting menstrual products with the model of United Way being a perfect organization to do this work because of the way United Way works with unions and businesses and in community. So the goal has been to drive as much collection during a March campaign, which we'll talk about, and then distribute those products out to agencies and community that United Way works with, particularly those that are working with people who are at risk or who are vulnerable menstruators, to ensure that they have access, free and easy access to products. So we did our first drive in 2017, and we were very excited about the fact that we collected about 30,000 individual products, largely through labor unions doing collections within their offices at events. And we felt that was pretty good. And then we went and distributed them out to community and realized they were gone in about a day. And you know, as we've spoken about, the issues and the stigma with menstruation mean that there wasn't really a radar on how deep the need was in our community, in our province here in BC, because people weren't talking about it. And as soon as we started doing the campaign, we started to hear, not just from people we knew, but from others reaching out immediately, whether they were teachers who had just been, you know, quietly stocking their desks for years with products for kids to hand out, or you know, friends talking about getting through university, never having access to a single menstrual product, they didn't have the money. But you know, really what I think resonated for us in realizing how big the issue was and that there was more that we needed to do, we're hearing from a lot of the nonprofits and agencies United Way works with here about what they'd also just been naturally dealing with, which ranged from, you know, kids taking paper towel out and sneaking it away, if you will, without people seeing it, to having to go and get kids who had been arrested for stealing tampons for themselves and their siblings. And I think once people started to hear that those stories were happening here in our community, it really started to change the dial of the campaign. And we started to think more about how it could be that we would make some significant policy change. I also want to acknowledge that Period Promise and United Way are, you know, one of a number of groups who have been moving the policy change here in Canada. There's been some great work done in Ontario. You know, big shout out to the folks in London, Ontario, who led on getting their municipality to provide free products to start with. Period Purse, Moon Sisters, Tampon Tuesday. These are all a lot of people, you know, really helping move the policy dial in Canada. So our second year, we managed to start to build out a larger campaign, get more businesses on board in particular, and to add to our union partnerships. And we collected over 200,000 products. And then in 2019, we ended up with over 500,000 products. And 2019 was a big year for us because around the time that we've been doing an annual collection in March, we also were able to partner with the government of BC after a significant amount of policy and advocacy work with them, where starting with a school board here in BC and New Westminster became the first school board in Canada to pass a motion to ensure that their school washrooms would have access to free menstrual products. And then working with the provincial government in April 2019, the Minister of Education, Rob Fleming, passed an order that all schools in BC would have access to free menstrual products in them, and some funding to do so. So we were, you know, started to really see momentum, because the only way that we could, you know, collections are amazing and they will always be a core part of what we do, partly because they do give people something that they can do very tangibly, and it helps, you know, raise awareness about the issue, particularly if you're seeing large scale publicity about the campaign. But it also did help us show how much need was out there, and talk to decision makers about how they could help. So we also then were able to partner. United Way has a partnership with the government of BC again on a research project, which is really important to us in terms of trying to determine how great period poverty is impacting people in community. And as we talked about a couple of times, getting that data, it's fairly absent. So trying to, and because people haven't talked about it, and there haven't been a significant number of studies, so the data has been an important piece as well. We can advance the slide. So we are really a movement. I think, you know, Neil's very kind when he acknowledges our work, but we immediately were able to identify champions around the province, both decision makers and then just really local people, whether they're on post-secondary campuses and advocating to to their deans and to presidents on campuses to ensure that there's products available to students, to local city councilors who have taken the cause forward themselves. We are really happy to see also last year that the Victoria City Council moved quickly into, instead of passing a motion to have a pilot project, that they actually considered menstrual products to be as important as toilet paper, which they are, and immediately started to implement a project. So, you know, we have seen some pretty significant change here in BC, which I think is really also instrumental in inspiring other jurisdictions, just as they've inspired us here to move forward. We can move the slide forward as well. So one of the pieces that we've also tried to move, because we want to really decrease the stigma and to expand the reach of the issue, is what we call the policy agreement. And so the policy agreement allows workplaces, our government, to actually sign on to it through the caucus, to agree that they'll provide free menstrual products in their washrooms. So the organization I work at does so. We even have you know, large partners like credit unions, insurance companies, and others coming on board. We can move the slide forward. And we have been really lucky to have a significant number of partners on this project. I think what I love about the Period Promise is the fact that every person who touches it makes it their own, whether that's going forward to their city council, or as you could do this in May, to go forward to decision makers and ask them to support Menstrual Hygiene Day, or going forward to their employer and asking for them to sign the agreement to put products in their washrooms. It really is something that has taken a mass of people around BC, but everybody personalizing it and making it their own, and showing that public support, so that we've been able to keep moving the conversation along. So we'll continue to do that this month in May. As I said, our collections in March, so we did have to pause based on public health guidelines, given the physical nature of collecting products in and distributing them out. But we're working really hard right now with United Way and our partners to look at how we get products back out to people who need them the most, particularly those who are, you know, emerging as vulnerable as we deal with COVID. And that means United Way is doing some great work in expanding out in community places like food hubs that also can distribute products that we've had donated. But you know, this really is a different policy lens, and I think the well-timed May Menstrual Hygiene Day helps us push decision makers again here in BC to put it back on the radar, because some of these issues just haven't been there in the last couple of months, as we all know. So thanks for having us on. We're happy to answer any questions as well.
Thank you so much, Ina, Jennifer, Nikki, Neil, Florence, for those presentations and the steps in which you've communicated to all of us on the call today about how we can engage digitally in the lead up to MHA and some of the initiatives that your respective organizations have underway. As many of you who know CanWaCH know, we're really big on capitalizing data as a driving force for policy engagement, as well as mobilizing people around common issues. And each of our three presentations today highlighted that so well. In the first presentation, we had the call to action from Ina, so loud and clear. You will all have access to the enormous toolkit and resources that WASH United has developed through links, as well as in a follow-up email that you'll receive tomorrow. And what the United Way's Period Promise campaign is doing demonstrates just that, coupling research with a movement made up of diverse actors, unions, businesses, and so much more to push for and successfully achieve wide-scale policy changes in the BC region, which is absolutely amazing. We then largely heard this echoed in Jennifer's remarks when she articulated that if it's not counted, it doesn't matter. So how can we have any idea of what's going on, what the situation is, and what works or what doesn't without this data? She also really challenged us to think a little bit differently, that movement building isn't always or only about reaching decision makers. It's also about social behavior change and really reaching into the communities in which we all live. Jennifer, you demonstrated so well when you spoke about how does one buying or wearing or posting about a bracelet here in Canada or any other country around the world directly impact programming that's happening on the ground. And it was really interesting to hear your perspectives on that. Before we dive into the Q&A portion, we thought we'd hear a little bit more about ways to engage and mobilize for MH Day. I'll pass it to you, Jane, to share what Isle has planned.
Hello, I hope you can all hear me. So Isle is the organization formerly known as LunaPads. We consider ourselves the OGs of sustainable menstruation. We've been in business since 1993. And during that time, we have made a lot of donations, both in product and money, to support menstrual equity causes all throughout Canada and the world. We're really well known for our partnership with AfriPads and our work in bringing reusables to the global south. Over the past couple of years, we've been trying to really think about what drives period poverty. And one of our answers is that one of the big causes is stigma. And so this year for MH Day, we are taking advantage of the time and the increased digital engagement we're having with our audience and our community to roll out a couple of initiatives that are directly focused in promoting education, in promoting the empowerment of the individual, and ending sort of menstrual stigma for those who are suffering period poverty, and for actually everyone who has a period. So we are rolling out a revamped teen booklet. Many of you may have received such a booklet when you first got your period that says, you know, you're a woman now, or other highly gendered language. We've created one that is trans inclusive, focused on the sustainability and environmental impact of periods, and also educates about period poverty to empower young menstruators to really consider the impact of periods and set them in a frame of mind that will make them future change makers down the line. This is being paired with two sex ed workshops. We had one yesterday, which was more geared towards an adult audience, and we're having one next week that is targeted towards parents who are looking to provide stigma-free sex ed and menstruation education to their kids, especially that they're now at home and perhaps not partnering with the school at this time. And lastly, we're really focusing on thinking through what periods in a pandemic mean, how human dignity and hygiene have become both elevated and depreciated during this time, and what that means for the most vulnerable in our society, who likely need this work more than ever before, and for many are experiencing period poverty for the first time because of the economic effects of this pandemic. So we've been partnering with local organizations to think through how we can support them at this time, and how can we activate others to support them at this time. So thank you.
Thank you for that, Jane. And don't worry, to everyone, we will be sharing the links of how you can get more information on what she said after the webinar. I also just wanted to flag that some of you may have joined us last week for our webinar on COVID-19 and WASH. And as we know, water, health, and sanitation is a key part of menstrual health and hygiene. And so to get more information, we just encourage you all to watch WaterAid's social media channels in the lead up to Menstrual Hygiene Day for more information on the initiatives that they have underway. I see that we have a number of questions in the chat box as well as the Q&A, so I'm going to dive right in there, and panelists, some are for all of you, and some are targeted to one or more. So maybe the quick one, just to start off, Ina, is directed at you, and it's just a question because I think we have a number of individual activists joining us today, and they're just wondering if individuals are also being encouraged to submit videos or success stories for the global video campaign.
Sure. I mean, yes, we would love to have as much possible videos as possible that we so we can cut a very nice video from it. The video is intended to look at what is needed and not at individual success stories. So on the website, there's a guidance what needs to be included, but that shouldn't discourage you from creating a video that you can use on your own social media channels, right? I mean, I think video reaches a lot of people. So what we can do is, if you send us a video that fits to what is required and you add a little bit what you've done, we try to make sure to upload it on to maybe not being able to cut everything into the video, but maybe provide a platform where we can still show your video.
Thank you, Ina. The next question is a big one, and it's for all of you, or a number of you, to answer. And it is, what do you think are the biggest gaps in the menstrual movement right now?
Maybe I answer. I don't know exactly if you ask for Canada or if you ask globally, etc. For me, it's always amazing to see how much support there is for providing products to the poor and marginalized. And I think the gaps are still there to reach everyone. And as long as you coordinate it as beautifully as was presented before, I think then you can identify the gaps together and go where they're needed. So I think, yeah, coordinating is hard. What is not known, I think, is a little bit the needs for education on girls. So this is not maybe, yeah, so to provide really, as also was said by Jen, like we need good modern education that are not like old-fashioned boring stuff, because menstruation opens so much doors to other development areas. So this would be my two gaps maybe for Canada, but there might be much more that you can speak to as well.
Yeah, I can jump into. I think, you know, and Neil's probably heard me say this too many times, but I always describe this campaign as an onion. Every time we touch a piece, we then take off another layer and we find out about gaps that we didn't even have on our radar. And again, I think, you know, part of what is needed in the movement is those partnerships and that constantly identifying where we could be doing more. And there's, you know, the understanding, for example, we had some lawyers raise the issue of the fact that courthouses don't have free menstrual products in them or access to them, which means that people aren't accessing justice in the way that they need to be able to, or they're not showing up for their court cases on days that they may be menstruating and not be able to access. And so those weren't, you know, those just aren't things that we can, as a largely volunteer group, always know. So the voices are extremely important. The ways that post-secondary students need to be dealing with poverty while on campuses is much different than having products in a washroom, which is, you know, core to some of our campaign. So in the layers, you know, it doesn't even start to get into some of the challenges, for example, of even getting products up to Northern Canada if they are collected by, you know, other partners that we work with. So I think the more voices that we work together and collaborate is how we identify those gaps, but they sometimes seem endless, quite frankly, because no one talks about them. And I think, you know, in the last few years, as this more global movement has evolved, we're now talking about it and seeing where those big holes are in both policy and also our ability to affect it.
And if I could just jump in as well, building on what's already been said, I think it's very much, and I've said this already, but it's about the research and being able to understand what the different issues are, the complexity of them. And then it's getting the funding to do that research, because we live in a very patriarchal world still. And so especially more scientific and technical funding, there's not a lot of funding for research, whether it's programs to understand what works or basic epidemiology, that sort of thing. And so the funding for large-scale programming or research is also very much lacking. And then the last thing, because understanding that it's not just about the products, because the products are so important, never going to argue that, but also understanding what else works. And if you can't do the product side of it, what can you do that will work and make a difference instead of that?
Can I just quickly jump in? Sorry, Megan.
Of course.
To add into all of that, I think that we definitely need to make sure that we're coordinating really well with each other. It's part of what we're working at the United Way of the Lower Mainland. I think we also need to make sure that we are conducting really good research and getting funding to conduct research, absolutely jumping on off of what Jennifer said as well. The only other piece I would add is that for us to have effective policy shifts made, we also need to be able to convert that data that we do have, whether it be good data or undeveloped yet, into good government relation strategies. And that's an entire skill set that is really difficult to develop and difficult to access, especially if you don't have money to pay for it, which a lot of these organizations and a lot of people in the movement aren't able to do. So that's one piece that is actually a huge aspect of how we can actually make shifts in what government policies and access to menstrual products or access to education about menstrual hygiene can actually look like. And without that conversion of knowledge and activism to government relations, we're not going to see shifts in policy because we're not actually able to access decision makers in any way.
Thank you so much to all of you. The next question we have maybe is centered towards you, Jen, but please, if any of the other panelists or contributors want to jump in, it's really about sustainability and some of the stigma that surrounds sustainability. So the person who submitted the question is working in South Sudan and Afghanistan, and said that there seems to be the impression that single-use menstrual pads are the sort of recommended norm or standard. And so how, in your experience, have you combated some of the stigma around reusable products? And of course, some of the challenges that the cup also provides that are unique to it. So over to you, Jennifer, but then please all feel free to jump in.
Yeah, so an excellent question. How much time do I have? So very true. So in most lower resource, low middle income settings, the disposable pad is seen as like the be all end all. It's the gold standard. And a lot of data collection and baseline kind of measures practices by, do you have access to disposable pads? Okay, it's good. Obviously that's missing out on everything else surrounding menstruation. When you talk to people who menstruate at baseline before they've had any education or anything like that, they want disposable pads. Fair enough, that's what they know, it works, it's easy, all nice things. However, people are also very pragmatic and they understand that they can't always access them. They're not always affordable. They're not stocked in shops. They might be low quality. There's a lot of places in Africa where you get the disposable pads that they itch and they burn, or they're covered in dust, they leak, you know, there's a whole bunch of issues. And so people are very willing to accept a reusable product when it goes along with, and it doesn't take a lot, especially for reusable products, reusable pads, you don't need a lot of education. People are already washing some sort of fabric to reuse, whether it's their underwear. Disposable pad is very familiar, it's easy, and when they understand that it'll last for 1 to 2 years, they jump on board pretty quickly for the most part. Cups is a whole other issue, but at the end, and it requires some more sensitive introduction, education, sensitization, working with community leaders as well. But they're absolutely possible in just about all settings. And again, people are very pragmatic. So even if at first glance they see a cup and they say, oh my gosh, this is, oh my gosh, I can't do this. You know, people have needs and they still menstruate regardless of the setting. And in very low resource settings, cups are actually an excellent option because they last for 10 years. They don't require as many trips to change them. They require less water, things like that. So yes, I mean, Yeah, it takes being in the community, knowing your, knowing who you have to go through and where you go to, what people you need to go through in order to get the reusable products, and just how to introduce them. In my experience and Femme's experience, they're feasible just about everywhere with a few exceptions.
Thank you for that, Jennifer. I think we've got time for one more question, and I hope it's okay. I'm going to sort of combine two questions into one. Again, this is to the full panel. There's one question about if you have any tips for new activists or organizations who are just starting maybe to engage in MHJ in new ways, what some tips or hints or to join the movement might be. And then a more specific question, and Nikki, maybe Period Purse is well equipped to answer this, but it's around educators in Canada. And if an educator in Canada wanted to advocate within their network to have menstrual hygiene products available in schools in Ontario, how could they best go about doing so? It might be just time for a quick answer now and maybe some individual follow-up afterwards, but I'll open the floor.
I can just sort of jump in with a quick thought. I think the first step to really engaging with this issue is to take advantage of just familiarizing yourself with the breadth of research that has been done over the past few years, specifically around these issues, both in your local context and a global context. We've had great research from Chris Boble out at the University of Massachusetts and many others who are really extending thinking on how these programs have done. Yes, Plan as well is a great way to, a great resource. So just education, especially right now during the Corona times, because so many organizations are having webinars, putting resources online, and it's a great chance to just get up to speed.
I think we have time for one more intervention if anyone else would like to jump in.
I can jump in on a quick teacher answer. I think one of the reasons that we were successful here is the grassroots change. So teachers who were, and also parents advocating to their own schools, to their own school boards, also partnering with the BC Teachers Federation. So we're happy to go offline and connect you into some Ontario resources for sure through some of the groups we partner with there. But I think, you know, that individual action to your school and your school district can be really powerful as well.
Thank you for that, Nikki. And if we can go to the next slide, please. I just, because I think that it segues well, that we are all very much open to direct communication. Our emails are there. Please don't hesitate to reach out to us, because I so wish that we had more time to keep this conversation going. There's some great questions that we didn't get a chance to get to, so please don't hesitate, again, to keep the dialogue open. I want to say a really big, warm, heartfelt thank you to all of our speakers for joining us today from across Canada and from around the world. And also, of course, thank you to all of the participants who took the time out of your busy day to join us and engaging on such an important topic. I hope you all are leaving this hour feeling more confident engaging on social media, in your communities with decision makers in the lead up to MHJ 2020 on May 28th, and then most importantly beyond. Once again, as I mentioned, we'll be sharing the recording of this webinar as well as a whole host of resources. Please don't hesitate to reach out to any of us if you have any follow-up questions. And please stay tuned for next week's webinar, which is Keeping the Engine Running, Challenges in Nonprofit Operations During COVID-19. And our webinar the week after might be of interest to this particular group because we're going to be speaking about menstrual hygiene in fragile and humanitarian contexts. And again, that's set for May 20th which will have simultaneous translation available for French and English. Registration details will also be included in tomorrow's email. Again, thank you so very much. Take care, everyone, and see you soon.